Most hospitals might have required a blood transfusion, which was unacceptable to Justine, and to her husband Gary as well.
It's her decision, obviously, but it'd make it a lot easier if she has support, and that's really my responsibility, and I'm taking it seriously.
The LeClairs found a solution to their problem in Englewood, New Jersey. Nearly 20 years ago, the Englewood Hospital began a bloodless surgery program. The policy grew out of the need of Jehovah's Witnesses, and now it has become the hospital's preferred method of surgery for all patients.
You see this thing here?
Yes.
That's not supposed to be there. So this is a tumor of some kind, okay?
Dr. Steinberger, who performed Justine's surgery, has become a firm believer in Englewood's avoidance of blood transfusions. For him, it's just good medicine.
The science seemed very real. The literature seemed to support it. And once we started doing the operations, the results were great. The risks of giving blood, in many cases, outweigh the benefits of giving blood. There are risks of infections. There are risks of lowering the immune response of the patient. There are risks of giving the wrong kind of blood. Errors can occur. And if there's any way to avoid getting a blood transfusion, one is better off in general if they can avoid it.
In any sense, do you feel the Jehovah's Witnesses have done medicine a service?
Definitely. They definitely have done medicine a service.
You are not accepting blood, regardless of the circumstances.
The key to successful bloodless surgery is preparation. Sherry Osawa directs the hospital's bloodless surgery program.
Many, many patients, estimates are as many as 40 or 50% of patients come to surgery anemic. They don't have enough blood cells. Very simply, dealing with that ahead of time, helping to build those patients' blood up, eliminates even the question of transfusion for many patients. We could perform even serious surgeries and even life-threatening situations bloodlessly with much greater success than other people would have expected, even than we expected initially.
And there is the cost of blood.
And it's immensely expensive, and if it's done for no good reason, that is billions of dollars of waste in the healthcare system. It costs about $1,100 to give 1 unit of blood, not to buy it, to transfuse 1 unit of blood.
When Englewood's program began in 1994, there were fewer than 10 hospitals offering programs for surgery without blood transfusions. Today, there are about 150, and many more are in development. There is more to successful bloodless surgery than preparation. At Englewood, they practice precision surgery with minimal blood loss. And if a patient loses blood and has agreed beforehand, the surgeon uses a technology that recycles the patient's own blood. Still, there is a resistance among surgeons to bloodless surgery. Both Dr. Steinberger and Sherry Osawa simply blame tradition and habit.
The resistance is primarily behaviorally based. Physicians get about between 3 to 6 hours of training in transfusion science in medical school. They don't know a whole lot about it. So most of bloodless medicine or transfusion-free surgery really is education for clinicians and how to handle these situations without blood.
Lately, doctors from other countries have taken an interest in bloodless surgery, particularly in Africa.
They're learning the techniques that we have learned from taking care of this specific population to use in their countries where either the blood supply is unsafe or unavailable.
Justine's surgery was successfully performed on May 9th. She went home to Georgia 2 days later.
Everything went very well, no problems. She's waking up from anesthesia. There was hardly any blood loss, and depending on how she feels tomorrow, she can leave when she feels ready to go.
You did a wonderful thing.
Well, let's see how she does after.
For Religion and Ethics News Weekly, I'm Betty Rollin in Englewood, New Jersey.
Justine LeClair left the hospital 2 days after her surgery, and she says she is doing wonderfully. On our calendar this week, Jews around the world observe the solemn holiday of Tisha B'Av, beginning sundown on Monday. Tisha B'Av is a day of fasting and lament marking the destruction of the first and second temples in Jerusalem and other tragedies in Jewish history.